Dear audience, let me present you my PhD studies, which is about the applications of dietary fiber in patients with metabolic disorders. My name is Evelin Juhász, and I'm a PhD student at the Doctoral School of Health Sciences. My vision is to normalize the metabolic disorders of the patients by receiving dietary fiber instead of taking medications. And my mission is to draw attention of the physicians to the results of the studies regarding the management of polycystic ovarian syndrome. Here you can see the three projects what we are working on. The first two are the network meta-analyses, and based on their results, we would like to perform a randomized control trial. So the first project is about ranking the effectiveness of non-soluble dietary fibers in type 2 diabetes. Actually, we are writing the manuscript, and we would like to submit our paper in the Diabetes Care Journal. A little background about the topic. 6.28% of the world's population has type 2 diabetes. And previous studies show that dietary fiber has a potential to reduce cardiovascular disease and to control hyperglycemia in type 2 diabetes. But what are these dietary fibers? Fibers means carbohydrate polymers with 3 or more monomeric units, which neither digested or absorbed in the human small intestine. These dietary fibers traditionally classified as soluble and non-soluble dietary fibers. They had different effects. For example, soluble dietary fiber delays the absorption in the gastrointestinal tract and could prevent cholesterol to be broken down and digested. And insoluble fibers could speed up food through the digestive tract and could add the bulk to prevent constipation. And I would like to emphasize that using dietary fibers is a gap in the diabetes guidelines. So our aim is to investigate the effects of dietary fiber supplementation on glycemic control and lipid profile in patients with type 2 diabetes. Our clinical question was, does dietary fiber intake could decrease the hemoglobin 1C level compared to another type of dietary fiber or no dietary fiber intake? The population was patients with type 2 diabetes. The interventions and comparators, soluble, non-soluble dietary fiber and no fiber intake. And the outcomes are the glycemic and the lipid factors. Our hypothesis is soluble dietary fiber intake can normalize glucose and lipid levels in patients with type 2 diabetes. We did a systematic search in the last year, and you can see the PRISMA flowchart. We could include 46 articles to our network meta-analysis. Our main outcome was the hemoglobin 1C level. On the A graph, you can see the network graph, which include 12 different type of dietary fibers. The size of the nodes is proportional to the number of the studies, and the thickness of the edges is proportional to the number of the each direct comparisons. On the B graph, you can see the Sukra curve, which provides a posterior surface under the cumulative ranking curve estimates which type of dietary fiber has the highest effect on reducing hemoglobin 1C level. Here you can see that galactomannan had the highest value and had the biggest area under the cumulative ranking curve. And in the C graph, you can see the A rankogram. Every intervention, every dietary fiber has a percentage, and if intervention closer to 100%, that dietary fiber was the most effective in this outcome. So the galactomannan was the most effective with 92%, and the less effective ones when patients didn't get fiber. From the lipid factors, we chose the HDL level results. Again, you can see the network graph. This network included 16 type of dietary fibers. And on the Sukra figure, you can see that gum arabic and resistant dextrin had a very similar effect. They had the highest value. And on the rankogram, again, the percentages, The gamma-rabic had 89% and the resistant dextrin had 83%. And the less effective ones was the beta-glucan in this outcome. This table summarizes all the results regarding to the nine outcomes, and galactomannan had the highest effect on the 4 outcomes from the 9. So as a conclusion, I can say that galactomannan, beta-glucan, and siloligosaharides were the most beneficial interventions in type 2 diabetes. And supplemented dietary fibers provides patients more convenient and efficient way to meet the standard dietary fiber intake. Our study strength that, to our knowledge, this is the first network meta-analysis assessing the effect of soluble dietary fibers in patients with type 2 diabetes. It has a rigorous methodology. We could assess 16 types of dietary fibers, and almost 3,000 patients were included. We have limitations as well, the small number of the direct comparisons, the different doses and formulations of the dietary fibers, and the patients had various backgrounds, diets, medications, and lifestyles. As a summary, I would like to say that using dietary fiber as a supplementation could increase the daily dietary fiber intake in a good way. And dietary fiber should play a greater role in dietary counseling. And the implication for research, I suggest that further and long-term high-quality RCTs are needed where explore newer type of dietary fibers, for example, siloligosaharides. And these beneficial effects of this fiber should be examined in other type of disease, which include metabolic disorders, for example, PCOS or obesity. Our second project is about the effects of different dietary approaches in women with polycystic ovary syndrome. This is a systematic review and network meta-analysis. A short background about the topic. PCOS is one of the most common endocrine disease in women with reproductive age. And in the lifestyle modification, dietary, exercise, and behavior therapies are recommended for the first-line approaches in the management of PCOS, but there is no or limited evidence about the specific dietary composition. So that's why our aim is to identify the most effective dietary approach in the treatment of PCOS. So our clinical question is which dietary approach has the highest effect on normalizing metabolic and hormonal measures in women with PCOS? The population is women with PCOS. The interventions and comparators are the different type of dietary interventions, and the outcomes are the anthropometric, metabolic, and hormonal measures. Our hypothesis is dietary approaches can normalize metabolic and hormonal parameters in patients with PCOS. We did a systematic search in May on 5 databases, and actually we finished the data extraction. Our third project is the effectiveness of dietary fiber on the ovarian function and metabolic balance in women with polycystic ovarian syndrome. A quick background again about the topic. PCOS has a lot of clinical manifestations, and a significant number of the patients has insulin resistance, hyperinsulinemia, and obesity as well. And in the first choice treatment, these patients get insulin sensitizers, which has serious short and long-term complications. And regarding to the literature, dietary fiber could be an alternative treatment for these women. So our aim is to examine the effects of dietary fiber in treatment of PCOS. Our clinical question is that can galactomannan improve metabolic disorders in PCOS? The population is women with PCOS. The intervention would be the galactomannan based on the first network meta-analysis result. The comparator is placebo, and the main outcome is the ovulation, and additional outcomes are the glycemic factors, hormonal parameters, and lipid factors. And our hypothesis is galactomannan is not inferior than metformin in the treatment of women with PCOS. We will include those women who are aged between 18 and 45, diagnosed with PCOS and higher BMI than 25 kg per square meter. We would exclude those women who are pregnant or lactating, using other medications and on hormonal therapies, had a previous surgery on the ovaries, or has symptoms on thyroid glands, or having Cushing syndrome. After the randomization, on the A arm they would get the galactomannan 1 gram per day, and on the arm B they would get maltodextrin, and the intervention would last 3 or 6 months. And the outcomes, again, the main outcome would be the ovulation, and the secondary outcomes are the glycemic factors, hormonal parameters, lipid factors, and non-alcoholic fatty liver disease. We would like to we're planning to submit these papers in this summer. And as a dietitian, I can't say anything else than Hippocrates did. Let food be thy medicine, and medicine by thy food. Thank you for your attention.
Thank you for the nice presentation. As a dietitian, would you recommend to non-diabetic people to take these soluble fibers? Because I guess the more fibers you eat, the better for your guts and for your health. Or are there any, I don't know, exclusion criteria or something that...
Yes, thank you for your question. Nutritionists usually suggest that eat more fiber as you can. Try to reach at least 25 or 30 grams per day. And I think that these dietary fiber supplementation could be a good way to increase the dietary fiber intake for healthy people as well.
Congrats for the presentation. Actually, I already looked up half of my question on the Wikipedia, because I was very curious how the dietary fibers are actually working, and we talked a lot about this, but I'm very curious whether the connection of dietary fibers and the effectiveness of them, and the connection with the microbiome. Actually, I saw that how the fibers are actually acting, and what is the background, but also probably there are a lot of differences in the results, because the gut microbiome and a lot of differences are there between countries and populations. What do you know about this part?
Yes. I think as you could see that soluble and non-soluble dietary fibers have different effects, but in the soluble dietary fibers group, I would say the same, because some of them has prebiotic effects, for example, for the inulin, and in the microbiome, for example, lactobacillus and bifidobacteria can ferment these fibers, and the others are just could slow the absorption and delays the gastric emptying. So they have very different effects.
Congratulations for this really great progress. We are living in the world of and times of dietary supplements, I can say. And do you think can there be a difference between taking elevated levels of fibers via the supplements, or maintaining a balanced fiber-rich diet, like from taking it from vegetables and normal foods? Or have you thought about it or investigated it?
Yeah, that's a good question. As a dietitian, I always say that try to increase the dietary fiber intake from foods. But after these results, I would say that supplementation dietary fibers could be good alternative dietary fiber intake as well.